This product is used to temporarily relieve a nasal congestion due to the common cold, sinusitis, hay fever, and allergies. It works by narrowing the blood vessels in the nose to reduce swelling and congestion. It should be used as needed, following the dosage instructions on the label. Use it when you feel congested, but do not exceed the recommended dosage. To use Vicks Qlearquil Aerosol Mist, simply follow the directions on the product package or as directed by your doctor. Gently blow your nose before using the medication, then close one nostril with your finger and place the spray tip into the other nostril. Spray the medication while breathing in through your nose, and repeat for the other nostril if needed. Avoid spraying the medication into your eyes or onto the middle of the inside of your nose. After each use, rinse the spray tip with hot water or wipe with a clean tissue, making sure no water gets inside the container. This medication only provides temporary relief, so do not exceed the recommended dosage or frequency. Using it for more than 3 days may cause rebound congestion, characterized by long-term redness and swelling inside the nose and increased runny nose. If this occurs, stop using the medication and consult your doctor or pharmacist. If your condition worsens or lasts after 3 days, be sure to inform your doctor. When using Vicks Qlearquil Aerosol Mist, you may experience temporary burning, stinging, dryness in the nose, runny nose, and sneezing. If these effects persist or worsen, notify your doctor or pharmacist. If prescribed by your doctor, remember that they have determined the benefits of this medication outweigh the potential side effects. Many people using this medication do not experience serious side effects. Notify your doctor immediately if you experience any serious side effects such as changes in heartbeat, dizziness, nausea, headache, mood changes, trouble sleeping, shaking, unusual sweating, or weakness. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you experience any other effects, contact your doctor or pharmacist. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report any side effects to Health Canada at 1-866-234-2345. Before using Vicks Qlearquil Aerosol Mist, make sure to inform your doctor if you have any allergies to this product or other similar medications. It's important to also discuss with your doctor if you have any health issues such as heart disease, overactive thyroid, diabetes, high blood pressure, or difficulty urinating. If you are planning to have surgery, be sure to inform your doctor about all the medications you are using. If you have children, it's important to check with your doctor or pharmacist before giving them this nasal decongestant. For pregnant women, only use this medication if it is clearly needed, and be sure to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if this drug passes into breast milk. Always follow your doctor's advice when using this medication. When using Vicks Qlearquil Aerosol Mist, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's also crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. In particular, be cautious about taking MAO inhibitors with this medication, as it may cause a serious, possibly fatal, drug interaction. You should avoid taking MAO inhibitors such as isocarboxazid, linezolid, metaxalone, methylene blue, moclobamide, phenelzyme, procarbazine, razagiline, sulfinamide, selegiline, and tranylcypromine during treatment with this medication. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. It's important to ask your doctor when to start or stop taking this medication. As for the daily dosage and optimal timing, make sure to follow the instructions provided by your doctor or on the product label. It's best to take this medication at the recommended times to ensure its effectiveness. If someone has accidentally taken too much of Vicks Qlearquil Aerosol Mist and is experiencing serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include drowsiness, slow heartbeat, dizziness, and fainting. It's important to be cautious and follow the recommended dosage to avoid any potential overdose. Always consult a healthcare professional if you have any concerns. Do not share this medication with others, as it may spread infection. It is important to talk to your doctor or pharmacist about which nasal decongestant product is best for you. Vicks Qlearquil Aerosol Mist is used to relieve nasal congestion caused by colds, allergies, and sinus infections. It works by shrinking swollen blood vessels in the nasal passages, making it easier to breathe. This medication is for use in the nose only. Follow all directions on the product package, or use as directed by your doctor. Use it as needed, usually every 10 to 12 hours as necessary. Do not use more than 2 times in 24 hours. If you are using this medication for allergies, continue to use it for the full time recommended by your doctor, even if symptoms disappear after a few doses. This medication should be used when you first start to feel symptoms. Do not use it to prevent symptoms. Make sure to check the storage information on the package and keep the medication away from heat and light. Always store it out of the reach of children and pets. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.